Picture this: you have just returned from an amazing adventure abroad, feeling refreshed but also wondering about any unexpected travel souvenirs. Your health is a top priority, and sometimes that means thinking about less obvious concerns like tuberculosis. Regarding post-travel tuberculosis screening guidelines, the general recommendation is not for routine screening for every traveler. Instead, screening is typically recommended for individuals who have had specific, high-risk exposures to tuberculosis while traveling, especially to areas where tuberculosis is common. This approach is rooted in understanding how tuberculosis spreads and who is most vulnerable. Tuberculosis is caused by bacteria that usually attack the lungs, and it is transmitted through the air when an infected person coughs, sneezes, or speaks. The risk during travel depends on several key factors. First, the prevalence of tuberculosis in the country or region you visited. Some parts of the world have much higher rates of the disease. Second, the duration and nature of your stay. Extended stays, particularly in close contact settings like healthcare facilities, homeless shelters, or prisons, significantly increase the risk of exposure. Brief tourist visits to well-known areas usually pose a very low risk. Third, your personal immune status. Individuals with weakened immune systems, due to conditions like HIV, diabetes, or certain medications, are more susceptible to developing active tuberculosis if exposed. Finally, a known direct exposure to someone with active, infectious tuberculosis during your trip is a clear indicator for screening. So, if you believe you have had a high-risk exposure during your travels, the most important step is to consult with a healthcare professional. Be ready to discuss your travel itinerary in detail, including the specific countries or regions you visited, the duration of your stay, and any potential exposure events you might recall. Your doctor will then assess your individual risk and recommend appropriate screening tests. These screening tests typically involve either a tuberculin skin test, often called a TST, or an interferon gamma releases assay, known as an IGRA. Both tests are designed to detect if you have been infected with tuberculosis bacteria, even if you are not currently sick. A positive result does not necessarily mean you have active tuberculosis disease, but it indicates latent tuberculosis infection, which can be treated to prevent future illness. Understanding these guidelines empowers you to make informed decisions about your health after travel. By being aware of your potential risks and knowing when to seek professional advice, you can ensure peace of mind and take proactive steps to protect yourself and those around you from tuberculosis, contributing to a healthier community.